Again, Pals in Seconds was created to make your life as an educator easier, which is why everything fits into one rolling bag, i.e. 4 mani kits, 4 Broslo tapes, 4 medication trays, 4 scenarios per module, and of course a 10-pack to give you a couple extra to play with on PD wheels. So here's how it works. Simply, as an educator, all you need is a table, and at that table you need to put out 1 mani kit. Match it up with a corresponding scenario. Put out 1 of the 4 matching practice med trays. Give them a PD wheel, a Broslo tape, the answer sheet, and the answer key. And once that's done, you're ready to go. What this will look like from the student's perspective is they will walk up with their photocopied answer sheet, clipboard, and pen, and begin. After reading the scenario, all of which are real life and cover the most important topics covered in PALS, such as cardiac, respiratory, and shock. For example, a 6-year-old with a really fast heart rate of 240. He is awake and alert with good peripheral perfusion. What color zone do they fall into? What is the normal heart rate, respiratory rate, and systolic blood pressure? What is the child's ideal body weight? What size endotracheal tube? Where do you tape it at the lip? Then getting into the more advanced section with questions like, what is the dose of IV epinephrine in milligrams and milliliters? Or specifically for this scenario, what is the dose of adenosine in milligrams and milliliters? That way, students not only have to calculate or find the correct dosage in milligrams, micrograms, grams, etc., but also they then have to pull up the correct dose in a tiny syringe, or practice going from a large syringe to a smaller one with using stopcock. Then, once they're done, they can check their answers. Or even easier, a student can log onto their phone, answer the questions, and get real-time feedback, but also have access to each of the 3 to 5 minute quick tip videos that accompanies each scenario, covering the what you really need to know about shock, cardiac, and respiratory emergencies in 5 minutes or less. So whether you decide to set up 1 scenario with 1 mani kit or 4 scenarios around the room with 4 mani kits, and have students rotate between skill stations, the possibilities are truly unlimited by your imagination. Again, if you have any questions or would like to know more about PALS Prep in Seconds, please feel free to email me at scott@pedi-ed.com. Thanks so much.